Hi, this is Melissa Suyes, and this is my patient Michelle. We are getting ready to get started with the head, neck, face, you name it, exam. I just wanted to show you that we are here at work, and there's a blue curtain behind us, and then there is no cheat sheets around. That chart behind her is a drug compatibility chart. I'll zoom in a little. Whoops. See? And then we just have patient safety stuff taped up. That's a pregnancy test over there. And then this is rapid response. But I hope we don't need to use that this time around. Also, just bear with me because I'm still kind of nervous. Alright, we're going to get started. That's good. Okay. Good afternoon, Miss Legg. Is it okay if I call you Michelle?
Sure. Hello.
Okay. I'm gonna do a head, eyes, ears, nose, throat, skin assessment on you today, and I'll tell you as we go. We'll start off with different sections. If anything hurts at any time, just let me know and we'll stop. Okay. So first, we're gonna start with her skin on her upper extremities and her lower extremities. On her upper extremities, her skin is clean and dry. Temperature is normal. She has light tan skin and redness. A little bit of redness from the sun and some freckles. Also, her skin turgor is negative. Lower extremities, she has same smooth, dry skin, normal complexion. She has a few spider veins, varicose veins from working, and she no edema is noted in her ankles. Okay, next we're gonna move to your nails. If I can take a look at your nails. Her nails are smooth and firm. They're well groomed, cut short. Capillary refill is normal, less than 3 seconds. And can you go like this? And there's no evidence of clubbing. Okay, we're done with that. Now we're gonna move to your face and hair. You do your hair and scalp first. Her hair is smooth, fine texture. It's brown in color. Her scalp is clean, no dry pouches noted anywhere. Well groomed, well kept. Also, so we'll move down to your eyebrows. Eyelashes are well kept. They are normal. Eyelashes are thin and normal length. Her eyes, nose, mouth, and ears are all symmetrical to her face. Okay, so we're gonna do let me just feel her face. Is smooth texture as well, warm. She has a little bit of red from the sun and some freckles as well. Her sinuses, I'm gonna palpate. Let me know if you have any pressure or tenderness.
No.
Okay. Sinuses are normal. No tenderness noted. Also, we're going to move on to your TMJ here. This is testing cranial nerve 5, which is trigeminal. So if you can, I'm going to put my fingers here. You can open your mouth like you're chewing. And no tenderness.
No.
And no clicking noted either. That was cranial nerve 5. Now cranial nerve 7, which is your facial nerve. If you can, I'm going to have movement of your face. So can you close your eyes and open them? Raise your eyebrows. Good. Can you smile? Frown. Stick, how about your cheeks? And like a fish. Okay. That was cranial nerve 7. Next we're going to move to your vision. So with the vision we would use a Snellen test, which is testing farsightedness, and we would use a Rosenbaum test to test for nearsightedness and reading. But I do want to test your visual fields. So I have my pen light here, and I'll need you to cover one eye, and I'll cover the opposite eye. Okay. But I'm going to put this pen way out, and when you can see this pen, say when.
Done.
Okay. Good. Now the other one. Same thing. When you can see this pen, say when. Just focus on me.
Yeah.
Good. Okay. Next, we're going to do your ocular motor. Your cranial nerves 3, 4, and 6. 3 is ocular motor, 4 is trochlear, and 6 is abducens. And this has to do with eye muscles and reaction. So I'm going to have you do the 6 cardinal position of gaze. So I'm going to have you focus on this pen without moving your head, just move your eyes, okay? Okay, good. Next is the corneal light reflex. I'm just going to shine it in between. I'm not going to try to shine it directly. Just focus on my face here. And I see 2 twinkles, so that's positive. Also, we're going to do the cover-uncover test. So with this, I want you to focus on my pen. I need you to cover one eye. As you're focused, you focus with that pen. Okay, now quickly drop your hand and it's good and focused. Okay, let's do it again. Cover the other eye. Focus. Now drop your hand. And it focused. Good. Next we're going to do just like the outside of your eyes. As I said, eyebrows are good. And eyelashes, we're going to do, iris is hazel. Pupils are good. Pupils are good. I'll test them for reactive to light in just a minute. Sclera, conjunctiva, and are normal. Also, let's see, we're going to test, I'm going to go ahead and test your pupils for reflex. Equal. Alright, so just you look at me, I'm going to shine the light and watch your pupils. Okay? I'm going to do it again. Her pupils constrict with the light and then dilate when the light is moved away. So her pupils are equal and reactive. Okay. Alright, let's see. Let's move on to, I'm going to take a look with my ophthalmoscope here. Alrighty, I'm looking to this side. Here we're looking for the retinal background is normal. The optic disc is normal. Seems to be no occluded arteries. Positive for red reflex is positive. no occluded arteries noted. Also the width and the color and the crossings of the vessels are normal. And the retinal background is normal. And also there was no signs of hemorrhage or exudate. Okay, that was your optic. That was the optic nerve. Also, we test that, which is cranial nerve too, optic nerve. Now we're gonna move to your ears. Her ears are symmetrical to her face, the rest of her face. No piercings. Let me get my otoscope. Yeah. I'm gonna look into your ears, okay? Just let me know if you have any tenderness or. Her external canal and meatus. External canal, are normal. I did not see any redness or swelling. Same on this side. Everything looks good. Also, we can test for hearing. That will use cranial nerve 8, which is your acoustic nerve. So the first thing we're going to do is test for, I'm going to do the whisper test. Alright, so I'm going to whisper something. Okay, cover one ear. There we go. I'm going to whisper something in this ear, and then if you could repeat it back to me, okay?
The weather is hot outside.
Good. And close the other ear. It did not rain.
It did not rain today.
Okay. Perfect. That's with your ears. Let's move on to your nose. Also, we're gonna do smell, which that tests cranial nerve 1, olfactory. I almost forgot that one. Okay. Her nose is symmetrical. It's even with the rest of her face. Her septum. Her septum and her turbinates
I was hoping somebody else was going to keep going.
are equal. No redness, no swelling, no drainage noted in her nose. Okay. So now let's test for smell. I'm going to have you close your eyes. And, first let's test for patency. Can you close one nostril and sniff up? Good. And then close the other one and take a breath. Perfect. Okay, now we're going to test for smell. I'm going to have two things over here. First, we're going to do this one. Can you close your eyes? I'm going to, and close one nostril. And here, take a seat. Cinnamon? Cinnamon. Good. Second, can you close your eyes? Is this one. Can you close the other nostril and take a sniff in?
Vinegar?
Yes, very good. Okay, that's the nose. Now we're going to move to your mouth, your lips. Her lips are symmetrical, red, not dry, not cracked, no lesions or lumps or bumps noted. Let's look into your mouth with my pretend tongue depressor. Can you look and say, ah? Her uvula is no redness and it's midline. Okay, let me look her Stinson ducts are normal, and put your tongue up inside. Put your tongue inside and up. There you go. And her Wharton ducts are also visible and normal. No swelling no swelling noted. Let's see. So for taste, we would do cranial nerve 9. glossopharyngeal. And for movement of the tongue, we would do cranial nerve 11. No, taste. Taste is cranial nerve 9 and 10. 9 and 10 are in there. Vagus and glossopharyngeal, and also strength of the tongue is 12, which is hypoglossal. So, can you stick out your tongue for me and go to the right and go to the left and up and down to the movement. So there we go. That's good. Everything's good there. Okay, we're getting close to the end. Your neck, your lymph nodes. That's the last thing. Can you, real quick, the patient can speak, swallow, and has a positive gag reflex as well. That's positive. Okay, now let's move on to your neck. So her neck is evenly proportioned, skin is intact, there's no lesions, same color, normal, dry. Her trachea is midline. Okay, I'm gonna try to feel here the thyroid gland. Alright, if you can you swallow for me? Good. It's kind of hard to feel, but it's there. Okay, I'm gonna take a listen too, to see if I can hear any bruit. There's no bruit noted for the thyroid gland. Okay, now let's test these lymph nodes here. The post-auricular, and also there's an occipital. No tenderness. Just let me know if you feel any tenderness. Or the pre-auricular is good. Moving on up, we're going to do the sublingual, submandibular, submental. No swelling noted on any of these. And as you come down your posterior, anterior, and deep cervical ones, I'm not feeling any lymph nodes. And then you have your clavicular ones here. And everything's testing out good. Okay, I also want to test your carotid artery. Listen for bruit. Okay. And carotid artery is palpable and okay. Everything checks out. I think you're good to go.
Awesome.
That's the end.